Asian Americans are one of the least likely ethnic groups to utilize mental health services. From the standpoint of service inequity and mental health disparities, why is this the case? The purpose of this study was to investigate whether Asian Americans perceive barriers to service utilization and, where appropriate, identify treatment protocols to overcome these barriers and increase utilization. The rationale for this study is based on identifiable gaps in clinicians' practical use of the national culturally and linguistically appropriate service standards. Furthermore, by engaging directly with Asian Americans, the researchers hope to obtain more accurately represented data on factors affecting Asian American mental health utilization. The researchers incorporated a mixed method design. In line with this method's design, the researchers collected both qualitative and quantitative data via an electronic questionnaire comprising open and closed ended questions. The quantitative questions were designed to identify patterns in mental health treatment utilization and barriers to care. In contrast, qualitative questions were intended to identify prevalent themes such as intergenerational and racial trauma, cultural stigma, family influences in seeking mental health treatment, perceived lack of provider cultural competence, feelings of shame, and reliance on family and religious support. This study hoped to provide valuable insight into the intersectionality of the cultural and systemic barriers that influence Asian American attitudes towards mental health services. The research demonstrated that cultural understanding by a mental health provider would play a vital role in shaping a positive treatment experience. Greater cultural sensitivity by the service providers would have improved their experience. This study indicates that when a mental health provider demonstrated cultural competency and empathy, this resulted in effective treatment. Participants widely recognize that cultural stigma continues to serve as a major barrier to mental health care in Asian American communities. Respondents voiced concerns about being judged or misunderstood. This reflected the influence of cultural stigma and trust within the community, impacting their health service seeking behaviors. The findings suggest that both provider behaviors and cultural factors contribute to the underutilization of mental health services within the Asian American community. Relating to the study itself, a larger and more diverse sample would have improved the validity of the findings. Future studies should also investigate other variables such as gender, age, birthplace, and cultural identity. Social workers should uniformly align themselves with the national class standards to better serve the Asian American community. In social work practice, providers need to broaden their understanding of the various Asian American subgroups regarding cultural values, family dynamics, and help seeking attitudes and behaviors. Social workers should engage in continuous education, community engagement, and reflective practice. Combining these insights into daily practice supports communication, trust, and enhances the mental health needs of Asian American adults. In conclusion, cultural sensitivity and awareness of the intersectionality of factors such as age and gender with culture is essential when promoting mental health use and providing effective mental health treatment.